President Obama on a campaign-style push to sell health care reform to the American people. Early on, one of the president's major selling points was fixing the economy, but as the debate grows more and more intense, the president is turning up the heat on insurance companies. Take a listen to this.
But they're held hostage by health insurance companies that deny them coverage or drop their coverage or charge fees that they can't afford for care that they desperately need. It's hurting too many families and businesses. It's wrong. And we're going to fix it when we pass health insurance reform this year.
Insurance companies, are they the brand new public enemy #1 in the battle over health care? Joining us now is Congressman Gregg Harper, who is a Republican from Mississippi, and Congressman Jason Altmaier, a Democrat from Pennsylvania. Congressman Harper, first the president's surrogates were sort of demonizing all the protesters. Now the president is vilifying the insurance companies, except rather conveniently for Aetna, whose chief executive was a major Obama supporter. And now all of a sudden this morning, the president's health secretary is suggesting he's ready to abandon, to give up this government-run option and embrace nonprofit insurance cooperatives. What's your reaction?
Well, obviously, I get real nervous anytime I hear that the government is going to fix anything. That always makes one pretty uncomfortable, and we're not sure what kind of terms will be there. But, you're right. Just a couple of weeks ago, we were blaming the protesters, and don't forget the TV newscasters. And now it's the insurance companies is the flavor of the day, and I'm sure it'll change in the weeks to come. And it appears to be they've identified somebody that perhaps folks aren't thrilled with, and so let's go after them a little bit. And it sure looks like a campaign rather than a issue.
Congressman Altmaier, in the op-ed, and here it is today, the president repeated his famous promise. If you like your health care plan, you can keep your health care plan. He says it over and over. But isn't it true, sir, that there is nothing whatsoever in any of the current proposals that would prevent an employer from dropping worker coverage and simply paying, let's say, an 8% payroll penalty because it's easier and cheaper?
Well, the easiest and cheapest thing for an employer to do right now, if that's their concern, is nothing but cost, is to drop coverage right now. So I don't think that argument makes any sense.
Well, there's not a government alternative right now.
Well, but if you're an employer who right now offers insurance to your employees and you make the decision that that's not cost effective for you, there's nothing to prevent you from making the decision to drop coverage. The difference between what the president's talking about and what current law is if you're the unfortunate employee in that circumstance, you are going to have an option, not just the public option, but an entire menu of private insurance options as well.
Congressman Harper, the president insists that reform will not increase the deficit and will, in fact, reduce health care costs, but the nonpartisan CBO says neither of those things is true. They say the House plan will increase the deficit by $239 billion, and the CBO director himself said that the Democrats' plan will increase costs, not lower them. Whom do you believe?
Well, obviously, the CBO numbers are usually more accurate than any other set of numbers that we're going to see. And I think that's been the biggest concern for us, has been the fact that people are upset about deficit spending and the fact that we cannot continue at this rate. And I don't see how you can increase coverage, reduce costs, not have rationing, and tell us that we can pay for that, and without raising the deficit. So I think that's going to be a continuing issue for folks back home.
Congressman Altmaier, the president also promised, and I'll quote here, "I'll make sure that no government bureaucrat gets between you and the care you need." Isn't the opposite required? And in fact, I looked it up, page 30 of the House bill. It establishes what's called a health benefits committee with the power to determine, and I'll quote again on page 30 of the bill, the power to determine, quote, covered treatments and services. Isn't that a bureaucrat getting in between you and your doctor?
Well, what that is setting the minimum level of coverage that will be available to everyone under this federal health exchange. That's not getting in between you and your doctor. That's saying that at minimum, here are the services that an insurance company must offer if they wish to enter into the exchange.
But it doesn't say that. I mean, I read it on page 30. It doesn't say what you just claimed. It's very wide open, and it says they can determine covered treatments and services, which to me, as a lawyer, says they can deny it.
They can determine the minimum level of coverage.
Doesn't say that.
And again, under current law, there's nothing preventing the private insurance industry from denying your claim just because they don't want to pay it either. That's the problem that we're trying to solve.
It doesn't say that it determines minimum coverage. It says it determines coverage and treatments and services.
The bill says if you are an insurance company, and whether it be the public option or the private insurance industry, and you want to participate in the federal health exchange, which is a menu of options for the consumer, you have to abide by a minimum level of coverage. If you want to go above that, so be it. But it's going to set that minimum level of coverage, and the bill does say that.
Congressman Harper, maybe I misread it. I'll read it again. If so, I'll apologize. But Congressman Harper, you know, when I opened the op-ed this morning, I was expecting and I saw the president's op-ed. I was a bit surprised by it. I thought, well, surely he's going to address some of the major concerns that Americans have been expressing in town hall meetings and elsewhere. That would be, you know, the so-called public option, the government-run program, the high cost, potential rationing, losing current coverage, all of those things. He addressed none of those things. He seemed to ignore them, and he urged reforms essentially on matters that everybody already agrees on. Portable insurance covering pre-existing conditions, eliminating coverage caps, guaranteeing coverage. Are you a bit disappointed that here he has this grand opportunity and he doesn't utilize it?
Well, obviously, he's trying to get onto something that looks like he can get a little bit of support. The wheels are about to come off of this thing, and I think he's trying to refocus it and direct the attention against some perceived enemy in this process, which he's claimed to be the health insurance companies. But we've changed the language. Here we've gone from what is health care reform to health insurance reform. And, you know, they've done the same thing if you go back to cap and trade, changing from global warming to climate change. So this is a formula that they use, I think, either focus grouped or polled to come up with plans that they think will be a little more palatable.
Right.
But nobody wants this public option.
Congressman Harper, Congressman Altmaier, thank you both for being with us today. Julie?